If you're over 60, the cheese in your fridge could be silently affecting your heart, blood pressure, and energy. Some cheeses can increase your risk of heart attack, raise your stroke risk, and even reduce your chances of reaching 80 years old. Almost every senior eats these risky cheeses without realizing it, but some cheeses are actually superfoods. They can strengthen your bones, protect your arteries, improve digestion, and help maintain muscle mass as you age. Today, we'll go through the 4 worst cheeses you should never touch and the 4 best cheeses you should eat daily to stay mobile, independent, and vibrant in your golden years. Before we begin, take a moment to like this video, comment below where you're watching from and which cheese you eat most often, and subscribe for more guidance on staying healthy after 60. Let's start with the cheeses that silently harm your health. These cheeses may taste convenient or fancy, but can overload your heart, kidneys, and arteries. Worst cheese number 4, processed cheese slices. These bright, neatly wrapped squares might seem harmless, but they're far from real cheese. Less than half is actual dairy. The rest is emulsifiers, preservatives, artificial colors, and phosphates. Sodium overload and phosphates. 2 slices can have over 600 milligrams of sodium, about a quarter of your daily limit. Much of this sodium comes as sodium phosphate, which is linked to kidney decline, arterial stiffening, and faster aging of blood vessels and skin. Gut-disrupting additives. Emulsifiers can disturb your gut microbiome, increasing inflammation, worsening arthritis, joint pain, and cognitive function. Artificial colors and preservatives. These can interfere with healthy gut bacteria over time. Hidden trans fats. Even if the label says 0 grams, processed cheese can contain up to 0.5 grams per slice. Regular consumption builds up, raising bad cholesterol and fueling inflammation. Swap processed cheese slices for natural, aged cheeses. They provide protein, calcium, and beneficial compounds without chemicals. Worst cheese number 3, cheese spreads in jars. Cheese spreads that sit on shelves for months are not real food. They often contain more oils, modified starches, and chemicals than dairy. Many include partially hydrogenated oils, artificial trans fats, and over 500 milligrams of sodium in a few teaspoons. Additives like MSG or yeast extract may disrupt your nervous system, trigger headaches, or stress your metabolism. Regular consumption has been linked to obesity, diabetes, and heart disease. For seniors, these spreads are risky. Choose real aged cheeses instead. Worst cheese number 2, pre-shredded cheese in bags. Pre-shredded cheese may seem convenient, but it has lower quality and hidden chemicals. Anti-caking agents like cellulose are indigestible. Some brands include antifungal agents, which may disturb your gut microbiome. Shredded cheese often comes from lower quality milk, exposing you to more hormones or antibiotics. The shredding and packaging increase oxidation, nutrient loss, and contamination risk. For seniors, this risk outweighs convenience. Buy block cheese and shred it fresh at home for better nutrition. Worst cheese number 1, blue cheese. Blue cheese is a gourmet choice, but risky for seniors. Tyramine can spike blood pressure dangerously, especially on certain medications. Mold toxins. Mycotoxins from penicillium mold can accumulate in seniors, causing inflammation, fatigue, joint pain, and brain fog. Histamines. High levels can trigger headaches, digestive upset, and insomnia. Sodium and saturated fat. 1 ounce can have 400 milligrams of sodium and inflammatory fats, worsening arthritis and stiffening arteries. Blue cheese may seem fancy, but it's a health trap. Seniors should avoid it completely. Now let's discuss cheeses that are true allies for seniors. These cheeses protect your bones, support digestion, and help maintain muscle mass. Best cheese number 4, aged Gouda. Aged Gouda becomes more nutrient dense the longer it matures. Proteins break down into peptides, making them easier to digest. Seniors absorb amino acids more efficiently, supporting muscle repair and tissue health. Gouda is rich in vitamin K2, directing calcium to your bones instead of arteries, lowering cardiovascular risk and strengthening your skeleton. It contains CLA and postbiotics that support fat metabolism, immune function, gut health, and reduce inflammation. Most lactose is broken down during aging, so seniors with lactose sensitivity can usually enjoy it. 1 ounce daily with fruits or whole grains provides nutrients and supports gut health. Best cheese number 3, authentic Parmesan, Parmeo. Real, aged Parmesan 32 months or more is a nutritional powerhouse. Proteins are pre-digested, increasing amino acid absorption for muscle repair and collagen production. Its calcium-phosphorus-magnesium ratio allows nearly 100% calcium absorption, strengthening bones while protecting arteries. Parmesan also contains peptides that reduce anxiety, support sleep, and neurotransmitters that improve focus and mood. It is gut-friendly and virtually lactose-free. To maximize benefits, eat authentic Parmesan in small chunks rather than powder. 1 ounce provides 330 mg of calcium, more than a glass of milk. Best cheese number 2, Swiss Emment. Swiss cheese is low in sodium, high in protein, and rich in calcium. The aging process breaks down proteins for easier digestion. Its natural probiotics support gut health, which influences immunity, inflammation control, and cognitive function. Swiss cheese is heart-friendly because of its lower salt content and beneficial fats. 1 to 2 ounces a day helps maintain bone density and muscle strength. Best cheese number 1, cottage cheese. Cottage cheese is mild, versatile, and nutrient-dense. Packed with high-quality casein protein, it digests slowly, supporting muscle repair and satiety. It's rich in calcium and phosphorus, supporting bone strength, and its low sodium content is ideal for seniors managing blood pressure. Add fresh fruit or a handful of nuts for extra fiber, antioxidants, and healthy fats. Daily servings help maintain muscle mass, strengthen bones, and provide steady energy. Here's a simple plan to protect your health while enjoying cheese. Avoid processed slices, cheese spreads, pre-shredded bags, and blue cheese. Choose aged Gouda, authentic Parmesan, Swiss, and cottage cheese. Keep servings moderate 1 to 2 ounces daily. Combine cheeses with fruits, vegetables, and whole grains for gut support. Monitor blood pressure, kidney function, and digestion. Adjust intake as needed. Stay active with resistance training and walking to support muscle and bone health. Small, consistent changes can protect your heart, brain, joints, and overall vitality. Age is not a limitation. Choosing the right foods can help you maintain strength, independence, and quality of life. Better digestion, steadier energy, sharper memory, and stronger bones are possible with simple swaps. You don't need every trendy product, just the right nutrients in real, whole foods. Take control of your health today. Swap harmful cheeses for those that nourish your body. Your best years are ahead, full of energy, independence, and strength. Like this video if you learned something new, comment below which cheese you'll swap first, and subscribe for more practical, science-backed health tips. I'm Dr. Jocelyn, and I'm here to help you thrive after 60.